Human Metapneumovirus, or HMPV, might sound like a mouthful, but it's a virus that causes symptoms similar to the common cold. Think sniffles, cough, and maybe a fever. It's so common that most people have had it by the time they're 5 years old. Don't worry too much though, for most healthy people, HMPV is like a regular cold. HMPV is a respiratory virus, which means it affects your nose, throat, and lungs. It spreads through tiny droplets in the air when someone coughs or sneezes. You can also get it by touching a surface with the virus on it and then touching your face. While HMPV is usually mild, it can sometimes lead to more serious problems like bronchitis or pneumonia. This is more likely to happen in babies, older adults, or people with weakened immune systems. The good news is that most people recover from HMPV without any problems. While HMPV often causes upper respiratory infections, which affect your nose and throat, it can also travel down to your lungs. When this happens, it can lead to lower respiratory infections like bronchiolitis or pneumonia. These infections are more serious and can make it hard to breathe. Bronchiolitis is an inflammation of the small airways in the lungs called bronchioles. It's especially common in babies and young children. Pneumonia, on the other hand, is an infection of the tiny air sacs in your lungs. It can affect people of all ages, but is more serious in older adults and people with underlying health conditions. Like its cousin the flu, HMPV has a favorite time of year, winter and early spring. During these months, we tend to spend more time indoors, which makes it easier for viruses to spread. So, if you notice more sniffles and coughs around your workplace or child's daycare during these times, HMPV might be the culprit. Most children encounter HMPV before they turn 5. The first infection might be a bit rough, just like with many childhood illnesses. But here's the good news. Repeat infections tend to be milder. While young children are more likely to get HMPV, adults can get it too. And just like with kids, it's usually a mild illness for adults. However, older adults, particularly those over 65, are more vulnerable to severe HMPV infections. This is because our immune systems naturally weaken as we age, making us more susceptible to infections.